Hello, my name is Dr. Caroline Diamond and I'm the Director of Public Health for Torbay. I want today to let you know about the current position with COVID in Torbay and what you can do to protect yourself and your loved ones, and indeed how you can make sure that you, alongside the many people in Torbay who are doing this, can do your bit to get us through these winter months. So first, the numbers. Now, overall, the rate of COVID increase is levelling off, but the numbers of cases are still going up. The rate is also really particularly worryingly high in the 20 to 40 age group, and this is especially the case in Torquay. Now, last week there were 333 cases across the bay of COVID with a rate of 244 per 100,000. However, in Torquay, in the 20 to 40-year-old age group, this rate was 1,279 per 100,000. This is a higher rate in any age group that we've seen to date. And if this group is not particularly vigilant, the rate overall in Torbay will go up. So please, I'm asking all of you, and particularly these young adults, to remember, think COVID. We all need to remember also that 1 in 3 people show no signs of COVID, even when they're infective. This is especially the case with the new variant, which is more transmissible, is easier to pass on. Because of this, we must please, when we leave our homes at all times, but especially inside, act like we have COVID and all those around us have COVID. This means in particular keeping your distance, not getting within 2 meters of others. I've got a message also for households and people in support bubbles today. Please keep in your bubbles, and if any of you have symptoms, even if you're not sure if it may be COVID, get a test. Don't forget also, and this is important, if you have symptoms or a positive test, the whole household, including the children, need to isolate. It's not just the person who's ill. Please remember this. I'm concerned that it is people not isolating when they should that is preventing our rates falling. Don't risk passing it on. Just to be clear, the new variant is more transmissible. It's likely to spread in households, so the whole household must isolate. Even those without symptoms can pass it on. Also remember, if you're a young adult, is that there are more people who are older who are getting really poorly from COVID. Younger people still can get very poorly from it, and they also can get the debilitating long COVID. Also, with this variant, and if you're asymptomatic, you may pass it on to your friends, and then they can pass it on in turn to those who are vulnerable. People are still dying of COVID in Torbay, and our local hospital at the moment is really, really challenged. No one is safe from this terrible illness, whatever their age. I know it's a strange time at the moment. You can see on the news that doctors and nurses around the country are really worried. I'm a doctor myself, and I really feel for my colleagues, particularly those in intensive care. But we also have the vaccine programme being rolled out now, which is great news. Some of us, myself included, will need to wait our turn to be vaccinated. But there are probably some of you out there who are listening to this, maybe who work with vulnerable people who are eligible. So if you're one of these, it's really important that you do take up this opportunity. Hundreds of people have volunteered to help against the fight to COVID in many, many ways, and this is also amazing. Yet again, I'd like to finish with that. So many of you are putting yourselves forward to help each other, and that brings real hope. Thank you, all of you.